Welcome. Thank you for joining Eluna's community conversation today, supporting youth impacted by substance use disorder in rural communities. As we worked with our panel to develop this conversation, we were reminded that no two rural areas are the same. However, there are many common strengths and challenges shared by these close-knit communities. The youth residing in rural areas and the community that they are raised in are inextricably linked, and the systems of support surrounding these children are worthy of deep conversation and exploration. Today, we will begin with a discussion of these unique strengths and some of the challenges. We will move through the conversation addressing barriers to accessing support, stigma, and issues of trust. Our conversation will conclude with strategies and stories of hope to inspire actionable steps and ideas to develop far-reaching support for generations to come. This panel and its moderator are uniquely qualified to provide their expertise and personal perspective. You'll soon find out why. We appreciate the hundreds of early registrations that came in and the heartfelt questions that we received for our panel. We welcome everyone here today into this shared space of learning, compassion, and growth. Thank you for being here. I'd now like to introduce our moderator, Amelia Farrell-Nicely. Welcome, Amelia.
Hi, everyone. Thank you so much for having me today. As she said, my name is Amelia. I am from West Virginia and I work as a journalist here. And so today's topic is really personal to me. For those of you that don't know, West Virginia is the state that's been hit hardest by the opioid crisis. We have the highest death rate from it. And that has acutely affected children here. I mostly write about foster care, and we have the nation's highest rate of kids coming into foster care because of the substance abuse crisis. So this really intersects with everything that I write about, including education and health outcomes for children. And so I'm really looking forward to what we'll learn today from our panelists. I want to let everyone know that we're going to have time for questions at the end of our conversation. So please use the Q&A feature as questions arise for each of you. And now let's introduce our panelists. I'm really excited for you all to meet them. Dr. Liza Nicholson, can you introduce yourself, please?
Good afternoon. Thank you. I've served in rural communities for over 16 years, focused on reducing health disparities, increasing healthcare access. There we go. I'm sorry, I'll start over. I'm sorry, I worked in rural communities for over 16 years. Working to reduce health disparities, increase access, and also equity in healthcare delivery, serving more in the public and population health space. I've worked with several amazing organizations, and currently I get to do that through Avail Management Services in helping them to support community-based initiatives around substance use disorder, prevention, treatment, and recovery, and then also looking at high-risk rural communities and their immediate response to the opioid crisis. Thank you for having me today.
Thanks for being here. And next we have Shay Hausman. Can you tell us a little bit about your background and what you focus on now?
Yeah, of course. Hi, my name is Shay. I take she, they pronouns. I grew up in Kentucky and I just moved back here to complete my master's of social work. I'm primarily interested in both youth substance use and perinatal substance use. So I have some experience working in a perinatal substance use treatment program and an adolescent specific substance use treatment program in Boston. And I've also had the experience of working at Camp Mariposa as a mentor in both New Hampshire and Kentucky. So I'm really excited to be here. Thanks for having me.
Thanks for joining us. And Mary Beth Collins, tell us more about yourself.
Good afternoon, everyone. I'm the Director of Programs at NACOA, the National Association for Children of Addiction, and I've worked with children's issues since the year 2000. focusing on childhood cancer issues, learning disabilities, behavior disorders, executive dysfunction, autism before joining NACOA almost 10 years ago. I'm a mother who actually did grow up in a family impacted by alcoholism, and very blessed that I've been able to pass along my hope and healing and the joys of recovery to my 2 adult sons.
That's amazing. Thank you for sharing that. Well, let's start. Let's jump in. We're going to begin with laying a foundation by honoring the strengths of rural communities. I know I am proud to live in a rural state, but we also recognize some of the unique challenges that they face compared to urban settings. So, Liza, I thought we could start with you. Can you talk more about the strengths of rural communities and maybe share some of your personal experience? I know you grew up in rural Alabama.
Yes, thank you. Some of the strengths of the rural community that I grew up in is that it was simpler paced, close-knit communities that provided more social capital, favoring just those close civic connections. Neighbors all know each other, everyone likes to help each other out and work together for the benefit of the entire community. Schools have smaller class sizes and students get to know each other's families as well as their administrators. Everyone comes together if something is needed. I can recall a story of a family that their home burned down. And so within an hour or so, so many people in the community had came together to offer food and clothing for the children, as well as funding actually to help them cover, any costs that they needed to pay out of pocket. So to see that at a young age, it automatically sparked something in me, just kind of knowing this is the community that I live in. People like to help each other. I'm reminded I contributed to an article in 2020 for Alabama Living magazine around why I love my hometown. And one of the things I noted was that what the community lacked in population, it made up for in courage, character, and hospitality. So I think I'll finish up by saying one of the biggest strengths that I feel like these communities have is resiliency. And that's just simply because they have to be due to the lack of the limited resources and access to some of the key things that they may need.
And we often see trends go through rural communities, right? But we also know that no two rural communities are the same. And Mary Beth, can you speak a little bit more to that?
Absolutely. We've worked with a variety of small towns and villages across the country. I like to refer to them as a well, because every single town or village has its own flavor. And so you see a variance, some economically, from some very economically challenged communities to some wonderfully privileged small villages. What their focus and how the majority of them make their money can have a huge variance, from farming to manufacturing to natural resource extraction, to share that with the rest of the world. And then ethnic disparity as well. So in the Deep South, we have our Black communities. We've got our indigenous populations around the country, each with their own individual flavor. And then some of our communities are, for instance, Latinx, and understanding what those strengths and those uniquenesses are will bode a great deal to successfully being able to work with them and support them properly.
And Shay, can you talk a little bit as well about some of the differences that you've noticed? And I know you have lived in an urban setting and then come back to a rural setting. And I know you grew up in a rural setting. So can you share a little bit about that and what you learned from living in both environments?
Yeah. So I grew up in Kentucky and then had the opportunity to go to Harvard and be in the Boston area for a few years. And I I want to add on to what Liza was talking about with everybody wanting to help each other and this kind of culture of community trust. My best friend from college was visiting me. She's from outside Chicago. And we got stuck on the side of a road in good old, backcountry roads. And we out of the woods emerged some men that offered to move our car and get us out of where we were stuck. And like, without thinking about it, we handed our car keys to these men that appear from the woods. And that like blew my friend's mind, but it was fairly normal because I think the culture of supporting each other and like just being there for whatever pops up is so prominent and so important in Kentucky culture.
I empathize with that a lot because we have reporters who move here from big cities, and I just leave my keys and wallet on the table of the coffee shop. I'm like, oh, it's West Virginia. We trust each other. It's fine. Well, let's move into barriers. And I think this is going to be a really important part of setting the tone for our conversation today. For each of you, what are some of the barriers unique to rural communities affected by substance use disorder? And importantly, I want to look at how does this impact a child's sense of hope for the future? And Mary Beth, let's start with you. Can you talk a little bit about economic disparities you see in these rural communities? And would love to hear about how the COVID-19 pandemic exacerbated some of those issues.
Well, those of us who worked in this field suspected this was going to be the case, and we are seeing that science has caught up. There's some very strong research that has specifically stated that the exasperation of the impact of COVID has been disproportionate for the lower economic communities and our ethnic minorities. So as we've already talked about, we see a lot of that throughout rural America. But when you sit and you think of the added layer of impact, where by the time we got to the second and fourth wave of COVID-19, we saw our permanently unemployed most affected by COVID and receiving the highest burden. So the impact of the disease itself that was being spread was highest felt in rural America. Add to that the economic impact by those who were losing their jobs, and what that does in a stressful way, in an unresolvable stressful way, on individual families as well as communities as a whole. And then for those who lost family members, we all, regardless of where we lived, were affected in a multi-pronged fashion by COVID. But in rural Americas, because they're small, because they're mighty networks, when one is affected, it affects the total, even in a grander sense. And when you sit and you think what we're talking about in this case is adults, those children are affected significantly because that unresolvable trauma or stress is living in the homes. And science has supported that unresolvable stress in the homes for children can stay with them and affect them throughout the lifespan. So this is what so many of us are really concerned about right now is, what is the totality of that impact of COVID in these small towns? And what are the resources and supports that are so essential in order to be able to respond to all of that stress and impact so that we can help them heal, so that we can change the trajectory of their life? The one additional aspect that I would bring in, which I think is really important, is the effect of the internet. And we discovered very quickly, because we all were affected, suddenly our technology and our ability to connect by internet and Wi-Fi was our lifeline to the outside world during the pandemic. So many communities were able to jump right in and identify areas where maybe the infrastructure wasn't strong enough, and they were able to strengthen it quickly. It was a much slower response in rural America. And even today, the percentage is still something like 13% of rural America is still struggling with solid, dependable internet connection. And as you can imagine, without that, you're at a complete disadvantage to accessing anything and everything that would help you recover. But overall, I think what we're going to continue to see is that rural America is going to have a much slower recovery because of its access to support and resources than the remainder of the country.
I think that internet part is really important because as I was reporting during the pandemic, we have, horrible broadband issues here in West Virginia, and they were rolling out telehealth, but that's really hard for a child to access who doesn't even have cell service in their small town, especially in our southern coal fields. So I think that's a really excellent point to make. And when these families are ready to turn or want to access help, it's not always there in rural communities. And Liza, can you talk a little bit about that from your experience?
Sure. And also we deal with the broadband issues here in Alabama as well. But we do see a lack of access to healthcare options around support for substance use disorder, prevention, treatment, as well as recovery. And then also a lack of access to information about substance use disorder. Just people just feel like they don't know enough about the topic. Oftentimes we'll have our treatment facilities that may be an hour or two away from where the person actually lives. And so the wait lists are pretty extensive at these facilities just because there are so few of them, or some of the barriers that we see. We've actually tried to implement programs that overcome some of these barriers around information and support. We've compiled a school resource guide as well as a community resource guide that actually has resources on housing, food, and transportation, and made that accessible to these individuals, the families, youth, school administrators alike. And by doing that, we were providing them support around social determinants of health, where now they're able to not only increase their community's capacity, but also the knowledge for these families and their capacity to have more information that help them sustain themselves where they are currently, as well as where they're trying to be in the future.
That's great. And Shay, I'd love to hear from you about your work with pregnant patients. Can you talk a little bit about that and the challenges that you see in that area, especially with transportation?
Yeah. So I think that there are a lot of barriers facing pregnant patients who are looking to pursue early recovery. Getting adequate access to recovery care and addiction treatment, as well as that really critical prenatal care, can be pretty difficult. We find some patients are in residential treatment and then are sometimes driving 2.5, 3 hours to get to a provider that is comfortable writing medication for opioid use disorder during pregnancy. And I think that's a really critical area to highlight. A lot of residential facilities aren't comfortable taking pregnant patients, so they're kind of facing barriers accessing treatment on both fronts. I also want to highlight that transportation and just kind of geographic separation of resources as it impacts the kids, because I really want to center the younger folks in this conversation as well. Right now I'm working at a Camp Mariposa in Kentucky, and that program is amazing and serves a lot of kids from Estill County. A lot of the school staff are there. The camp therapist is the school counselor for Estill, but getting to Estill County is really difficult. Driving from Lexington, where I live now, my partner and I were once driving down and went a good 45 minutes just trying to find a gas station on our way there. So I think getting through those roads when you don't have reliable access to transportation can be a barrier for some of those kiddos that are looking for a lot of the amazing resources and support that Camp Mariposa can offer.
And even when we can maybe solve some of those barriers, like we can provide transportation, also stigma can keep families from accessing support programs or accessing them for their children. So I want to ask you all, how does stigma show up as a barrier for these families who want to access support in rural communities? And Shay, I'm going to start with you. Can you talk a little bit what you see with families? And I know here in West Virginia, we have some families that have 4th, 5th generations in substance use, and it's still there's stigma that still exists. So can you talk a little bit about that and what you're seeing with families?
Yeah, I think that one of my favorite parts of my experience working with perinatal populations is I got to run a group on how to talk to youth about substance use. So how to communicate to your kids across different developmental stages about your own journey, and also emphasizing some preventative messaging. And generally, that's what the literature supports, is having informational conversations, providing accurate information about the impact of substance use, and having a really open, non-judgmental space in these conversations. But the instinct in these communities is to kind of bubble wrap kiddos, to try to hide, I guess, substance use or what could happen. And if you just really draw the blinds and you hold these kiddos tight, then that can feel like you're keeping them safe. But what that leads to is this lack of knowledge that Liza was talking about in communities. So I think that that's one of the really amazing things about Camp Mariposa, is that it incorporates psychoeducation around substance use, talks about the disease model of addiction, while also building up these coping skills for kids who may be facing really kind of unstable home environments. But I definitely think that really having transparent informational conversations across the child's development is really important.
And Mary Beth, when you look at rural communities, especially when everyone knows everyone might be, you might be related to some people that live in your neighborhood. Does that ever show up in stigma and maybe prevent people from seeking help, knowing that they might feel like they're being watched or news is going to travel around the town really quickly?
Oh, definitely. I think if you start at the most basic, these families operate with three very unspoken rules, and children learn them very quickly. Don't talk, don't trust, and don't feel. So if those are the rules that live within the house, you're definitely not going to express to anyone outside of what's happening in your family. And as you say, some of these communities, it's all one family. You hear in Appalachia, a family lives on a half of a mountain or something of that sort. But if you're operating on old stigmatized information and that community hasn't been educated properly on the understanding that we have today of what substance use disorder is, using stigma reducing language, then no one has an opportunity to understand that this is a disease, that there is evidence-based treatment, that there are things to support. So it's an ongoing intergenerational issue within the family and within the community. And these kids specifically, they're not going to out their family. They know those rules. They live those rules very, very well. And it's amazing how young a child can put on a mask that makes it look like everything is absolutely okay. And in fact, very proud that I'm the one that makes it okay. These children take on so much responsibility themselves. So if someone by chance would actually approach them, concerned about them, and they want to explore to see how these kids are, they're going to come back with loyalty, defensiveness, and they're going to protect their family with everything that they have.
I definitely have seen that in my reporting on child welfare. And so I think that's a great point that you make. And Liza, I want to ask you about schools specifically. I mean, schools are one of the main places that children may have access to help, whether it's a school counselor or a bus driver or a teacher, realizing that something is maybe not quite right in the home. But do schools do they always get it right, or where are they getting it wrong when it comes to helping break down that stigma of reaching these children?
Yeah, so to build upon what Shay said, as well as Mary Beth, it goes back to that education piece of it. We've seen where, schools may want to avoid or hide the fact that students or their community may need more support due to that stigma around substance use disorder. They feel that by talking about it, they are introducing drug use into their community and into their schools. And so we try to be very intentional to ensure that we're not only educating the school administrators, but also parents alike, as well as government officials, city council meetings. So we try to find ourselves in these spaces to meet these communities where they are and ensure that they have more information around the topic. So now they can share that with the children who can now take that into the homes. We've been very intentional about the prevention education process and looking at, again, I think Mary Beth or Shay mentioned this, around that person first language and language that's inclusive. So it's not stigmatizing, to help them know more, understand it more, and then engage in those conversations when they're at home.
I love what you said about the person first language. I think that's really important. And I think part of having those conversations, a huge part of that in any relationship is trust, right? So, can we talk a little bit about how trust comes into this and those relationships? And Shay, I'd love to hear from you about social workers. Social workers play a major role in reaching children who have been affected by substance abuse. And I've heard families say a social worker saved my family, and I've heard social workers ruined my family. And can you talk a little bit about that trust and how that comes to play and what from what you've seen?
Yeah. So we run a group at the treatment program where we talk about the hospital process for folks that are prescribed a medication for opioid use disorder and what that looks like, and the role of hospital social workers and kind of the considerations around involvement of DCBS. The way that we open that group is we put up a massive Post-it note and we say, what comes to mind when you think of the word social worker? And it's always about tearing apart families. It's always they're baby snatchers. And, you know, there are obviously issues in child welfare policy. There are obviously racist policies incorporated into these systems that need to be addressed. And so there is kind of this foundation of trust that needs to be built before you can work with anyone. I think what helps us get in the doors is to have peer support. I worked with really amazing peer support that have shared lived experience that can talk about their experience in treatment and with child protective services, but also just to give folks space to build relationship and to continue offering resources to show that even if somebody does end up with a case plan, that case plan is workable, that there are resources to help with those action items. I think a lot of parents can feel like that's just a laundry list of things that they're given to do that they don't have any way of working through. So it's really important to have community resources that are able to engage and work through those case plans, even when maybe their caseworker is super overloaded or isn't offering the support that they should be.
And Mary Beth, love to hear what you'd like to add on this topic of building trust. What have you learned in your work about this?
What you see when working with a small community or village is at times they're really protective of their community unit of outsiders. And some of it with good reason. You can have corporations come in and really take full advantage of a situation, not really creating any positive influence on the community, just taking research or taking resources and then leaving them, with nothing but negative effect. You can also, universities sometimes may do that on occasion. So there may be very good reason why they're very protective, not really welcoming and open to outsiders coming in. Sometimes that's an ethnic influence. You can see that with Latinx communities, where until you have earned the right to be able to speak on an intimate level. And it's a different process. In your general and urban communities, for instance, like if you have a support group and you have people sit down, they might start within 15 minutes, bearing their soul about every single thing that's going on in their family. You're not going to see that in these communities. They want to get to know and feel comfortable as a person. Maybe they want to make sure that they're comfortable with your intentions first. It can be a very slow process, and it's appropriate vetting if they don't have much experience dealing with organizations. And so often what we have found is finding a connection, finding a professional, finding a faith community, finding someone who everyone trusts to allow us to go in and be introduced. It is a soft welcome, and it helps make everyone feel so much more comfortable that, well, if our church feels comfortable with this organization, then it's probably something that I will listen to, or this might be a person that I would really love to get to know a little bit more and see why they think it's important that they come. And so having that type of vetting is a major influence for opening up lines of communication and opportunity to be able to ultimately serve those communities.
And Liza, can you speak a little bit about the peer aspect of this? Professionals who come into communities, those play a really important role as well. But where does the peer support network come into play, especially when we're talking about supporting children?
Absolutely. So we've, through some of our community-based initiatives, we've been able to implement a needs assessment where we're able to survey some of these rural communities, families, as well as healthcare professionals. We found that many of our community members and families share that they would rather reach out to a peer versus a healthcare professional if they saw that they were faced with a problem or they had a family member that was faced with a problem around substance use disorder. So we were happy to learn that, because then we were able to implement programs in these exact communities that could assist with that, knowing that that trust was there with a peer. We started to utilize peers as well as community health workers for youth and adults to be able to get information and kind of bridge the gap around health education, other specific topics that are important when it comes to talking about addiction and what that may look like in the home. We also saw that there was a lack of cultural responsiveness that some of the families felt. And so we took that information and also introduced a peer support program through the schools. So where children were able to utilize a peer if they felt comfortable talking about certain issues at home or mental health issues, even around maybe drug use that was happening within their families. They didn't have these group sessions with the counselors there at the schools, and we promoted that to ensure that those conversations were happening and that they felt supported, whether it be through a student peer or actually a community health worker type of peer, where the adults felt supported as well.
I was thinking about how just your answer reminded me that here in West Virginia, we just opened our first recovery high school, which is for students who are in recovery from substance abuse. And I'm wishing them the best. It seems like a really cool thing to add to our education system. But one of the challenges they've had is they know that peer support is so important, but state and federal laws about who can work with children in recovery, it's very difficult to find another teen who is far enough along in their recovery journey to provide that peer support. And so I've taken that to lawmakers and we've tried to figure out, is there something we can change in law or whatever, but that peer support is really important, but it can be difficult to find, especially when you're hoping to find a teen maybe who can be a peer support. Do any of you have experience with that or any thoughts on that? Maybe
Yeah,
not specifically,
the one thing that comes to mind so quickly for me is an education support group, which would allow you then to maneuver around that single obstacle, provide ongoing education for those teens, and provide them support. And you could expand beyond just the addiction itself, but start to approach some of the family issues.
And I'll speak to that just a bit. So the program that was utilized here in Alabama, one of them is a peer helper program. It's where these teens actually go through a training and they get more information around mental health, supporting your peers. And so it may not necessarily be aimed at addiction, but it's more so where that person, that student feels comfortable talking to someone who's closer to their own age or someone who have dealt with addiction in their own household.
Well, let's talk a little bit about strategies, and I'm excited for this part so we can learn and take this back into our own communities. How can this discussion inform how we support rural youth and families affected by the opioid and drug crisis? And this is a big part of the discussion, but would love to just start with building trust and strengthening ties. So Shay, let's start with you. Can you talk a little bit about strategies for us?
Yeah, I mean, I think to build on to the discussion of peers as they relate to youth, when I worked at the Adolescent Substance Use and Addiction Program at Boston Children's Hospital, that was one of the things that we consistently saw was amazing for youth in literature. But like you were mentioning, there are those barriers of finding a peer-aged person that does have that sufficient training and sufficient amount of recovery under their belt. one of the things that relates to kiddos that may not be using but have substance use in their family is a peer support at Camp Mariposa. There are counselors in trainings or CITs that are available as additional support and also a role model for kids at camp. I think that's one of the most beautiful things about the model. When I went to New Hampshire, the first time that I went to Camp Mariposa, I thought I was there for a day and I was going to learn about the model. And I lived in Massachusetts, and that was going to be my one day with Camp Mariposa. And at the end of every camp, they have what's called letters to addiction, and all the kids and sometimes mentors and especially the CITs write letters to addiction where they talk about what's been going on in their home life and how addiction has impacted them and what they're doing to prevent addiction in themselves. And it's so beautiful. One of the kiddos wrote a really, really heavy letter, was having a really hard time. And I watched as one of the CITs just like took him under his wing and was like, I have been there. And I know a lot of these kids say they feel like they're the only person in the world that has substance use in their family. It's a really isolating experience. But just that near peer model of having these CITs there to show support and to model some of these coping mechanisms can be really, really beautiful. After I saw that, I got in my car and I just cried, and I have been coming back for a few years now. So I think that near peer model is a really important part of supporting these kiddos and showing that they're not alone.
Absolutely. I'm glad you shared that story with us. Mary Beth, what would you like to add to this topic of strategies for youth?
Well, I think the most important in the rural communities, it kind of falls into two buckets. So it's the community education piece and then the systematic process to develop support and programs. So on the education, it's not just making information available to the families themselves, which is essential, but also everyone in the community. What we know for sure is it only takes one caring adult to make a difference in the life of a child who's been impacted by addiction in the family. And so those adults can be your teachers. They could be someone in family ministry at your church. It could be your band leader or your soccer coach. But in trainings, I'll often ask, we're training for group leaders, and I'll say, do you think that those adults are aware of how addiction affects children in their community? And we get a lot of crickets. I think there's a long way still to go to educate all of our adults in the community about what we're talking about, what addiction is, what it's not, and how it affects children. By educating, the entire community, then we continue to be community minded about how to move forward and become more progressive. On the programmatic development and systems side, again, very much a wildflower variety. I have seen, and I make myself available. I'll talk with anyone as they start the process until they're ready to get a program up and running. And sometimes that's been a span of over 2 years. Some of these communities, it's a very slow process, and sometimes it's just because that's the pace. Other times it comes down to who needs to be part of the decision making. And so understanding that you have to work at the pace of the community is respectful, it's ethical, and you really can't modify that at all. Otherwise, unfortunately, you're probably not going to be very successful about bringing new programming into the community. I think one of my most amazing stories, and I love to work with the Indigenous communities, and they wanted to bring some really meaningful programmatic support to their children. And I met a couple of times with some of the programmatic developers, and they were really excited about it. And I was ready to make the next appointment. And they said, oh, wait a minute, we're not quite ready. And I said, oh, so what's the next step of the process? Well, then they had a process where they had to go through their own hierarchy. The elders actually had to christen the entire plan, the program. They really had to bring a lot of rich information. And it reminds you of the old ways that communities worked, where we respected our elders. And it's a beautiful part that's very much alive and well in our Indigenous communities today. And in this particular case, those elders were so excited and couldn't wait to make that opportunity into a reality in their community. And so they pretty much ran back and said, oh, they are excited. They can't wait to hear more. Let's go ahead and set up that meeting. And I love to get those kinds of messages. When you get that green light and you're ready to move forward, you know that that's an exciting time for the community and for what's going to become available to families.
That's a really powerful story, and I think something that is unique to working with communities that are rural, right? You would probably not have that experience in an urban setting, so that's really, thank you for sharing that with us. And Liza, why don't you share with us, what strategies that you might have for supporting rural youth and families?
Absolutely. Also, I wanted to touch on a little bit about Mary Beth and her statement. Thinking about that community education and meeting people where they are is instrumental. We found that we've utilized some of our peer support and community health workers in different types of settings, in outreach centers, on university campuses, with law enforcement, also in faith-based organizations. And I do have a story to share there. We were able to work with a faith-based organization for one of our community-based initiatives, and they had a support group. And it started just in-house. They were working with their congregation. And then we were able to support them in increasing the amount of days they could offer that support, and then also increasing the surrounding counties where families, youth alike could come in and all get that support at once. And so it was a little bit different from your typical support group where you may only have adults or you may only have youth. We were able to utilize it and have the family there as a whole. We also have worked with the Strengthening Families program, where the parents and the youth come together. They all, they're first separated and they get information on different topics. They get to utilize it as a safe space to ask specific questions to professionals and experts. And then they also then get to bring in the parents as well. And so now they're together, they kind of get to interact more, engage more in those conversations outside of the home where there may be some concerns. So they feel a little bit more comfortable. They feel like they have experts in tow where their questions can really be answered, and they kind of get to the bottom of what some of their concerns are. And then that takes a bit of a positive vibe back into the home so they can continue those conversations. We've also saw where there was a little bit of a gap or a disconnect from the clinical setting, where sometimes if a parent went in or a child went in, they didn't really feel like they could understand exactly maybe what the health professional was actually giving them as far as direction. And so by putting a community health worker or a peer in that actual facility, we saw that families would go then to that community health worker's desk and say, hey, can you help us with this social support, whether that be financial, even if it was getting them financial aid to help with getting maybe prescriptions or treatment, they more likely utilize that peer that was in the facility. So that was a real win for us. So we took that model and put it across different areas, university campuses. So where there are college students that may have concerns or be dealing with some things at home, they actually had support on campus where they can go and talk, get brochures to take back home, get different education around the topic. We would place them in public libraries or community-based outreach centers where youth would come in to get help with their homework. And surprisingly, those homework conversations would often lead to them asking questions about something they may have heard in the home or something they've been wondering about. And that would open that door for that peer or that community health worker to be able to help provide education there. Once the parent would come in to pick them up, it then engaged all of them in the conversation. And so we've seen that have a big positive impact in a lot of our communities, especially with the youth. And so we've been extremely proud of that program.
And can we talk a little bit more about other programs? I think it's really cool to hear specifically what you all are doing. Liza, can you expand, or can you talk a little bit more specifically with schools, other programs that you've been able to implement?
Sure, we've been able to implement the education piece in schools by starting with the school administrators. And so in one of their professional development days, we have them all come in. We have an expert to come in and probably provide, I'm sorry, not probably, but provide information around opioid education, and then provide them with naloxone kits that are able to, if they find themselves in a situation where someone may be having an overdose, they now have the tools they need to try and reverse that as they're waiting on first responders. So we've had that across our state, where our public health departments have had access to provide the naloxone kits to families, to schools. And so we've been excited about that. So many people have reached out to our organization after hearing about this education and wanted it for their staff. In that, when we have this for the school administrators, we also invite the parents. So the parents do have the ability to come in during these sessions. And so it then kind of trickles down to the students. Students are now at home. Now they are having these deeper conversations in their safe space at home.
That is really interesting. We have naloxone in all of our schools, but I haven't heard about that education piece being coupled with it. And so I think that's a really important part to note. And Shay, can you talk a little bit about programs that you've seen in Kentucky that have made a difference?
Yeah, I think like we've talked a lot about kind of that very extractive way that a lot of corporations or research organizations or universities work within rural communities. And I think that one of the things that I learned from my experience at the perinatal treatment clinic was that cultural humility often looks like an adaptation of evidence-based practices to incorporate culturally relevant practices that are already taking place and that already feel grounded and effective for these communities. So I grew up in Kentucky, and I was really frustrated as I read more into the literature that there wasn't as much harm reduction as I would have loved to see. And a lot of these amazing harm reduction based or medication based treatments and practices weren't as available. But when you look at implementing these best practices, it's really important to incorporate kind of the 12-step language and the religious orientation of a lot of 12-step programs to folks where that's what recovery looks like for them, and that's what effective treatment looks like for them. So I think a lot of the literature can be very black and white, and this is the way to implement, but that doesn't work. You can't just throw an intervention into a community. Like I think all of us have said, we've adapted, even the Camp Mariposa in Kentucky is kind of adapting to respect the importance of religion in these communities. It actually ends Saturday night instead of Sunday morning, like a lot of the other camps, so that kiddos can attend church with their families on Sundays. We also have a lot of church staff there. Restoration Church, which is in Estill County, actually uses their van to shuttle a lot of these kids from their houses to camp. So that was kind of one of the ways that we tailored the program to have familiar faces in camp and to address that transportation barrier.
And Mary Beth, for youth and families in rural communities who don't have access to a physical space or for some of these programs or education and support, virtual programming is an option. So can you talk a little bit about how that's been successful and any thoughts you could share on that for people joining us today?
Well, I'd say the pandemic took care of that for everyone. There were some of us who were very excited to start bringing technology into, creative solutions. But that was very slow going. And as we've already said, some of that even at a slower pace in rural America. And then the pandemic hit. And suddenly overnight, everyone had to shift to understanding, how do we do this online? It was amazing. And so for our two huge community wide programs, so we've got the Children's Program Kit, which is a malleable kit that allows you to be able to create a variety of education support programs for kids kindergarten to 12th grade. And then we've got Celebrating Families, which is our whole family recovery program. Both of those, we immediately took implementation measures to be able to bring it online. Even before we had the initial instructions, we had people contacting us saying, our families can't afford to be on their own. We need to get them together right away. And so I was working with every day organizations and people just trying to be creative. How do we do this? What do we do? And we now have implementation measures for 100% virtual or hybrid, where that takes care of some of your proximity. So if you've got somebody that lives 5 hours away, they can participate in a program where half of the people, for instance, are in person. The other type of hybrid is inclement weather. And as we know, some of our communities, if there's a storm, if there's a threat of a hurricane, if there's, whatever, you wouldn't physically want them to gather. It would be dangerous, but you could still offer services online. And so it's opened up this incredible opportunity where people have found comfort virtually, and now they're taking full advantage of it. But what we've seen is even an extension of it. So they're actually able to offer more. A lot of these programs that started operating during the pandemic, they wanted their families to be able to get together more than just once a week. So for instance, one of my favorites was up in New York, and they did a bingo night, and they did it online. And as everything opened back up, I checked in with them and I said, so how are things going? And they said, oh, we can't give up our game night online. So here's another wonderful opportunity for families in recovery to continue to get together. That's their support system. And you might not be able to do it again if for that person that's 5 hours away, they get to be part of that support system where they wouldn't have otherwise. If you've got kids who are involved in kinship programs, they're taken out of state, but they can take part in our Celebrating Families program with a virtual model or a hybrid model. We even have ACOA education discussion meetings that we have just started to formulate, because the most important resource for these children is a parent who has healed from their own influence as a child. And so again, getting back to the importance of education and helping families feel comfortable, whether they're going to demonstratively walk into a building or not, we have an online model where adults can enter those meetings, get a little education about what is the influence of you as a child and what are the opportunities to heal as an adult, and how can you share that healing with your children. And we host that once a month. So we're really trying to take advantage of what we've gained, both in the technological advancements and in communities' comfort, to be able to continue to bring these new programmatic options to communities. And I think it's a huge win for our rural communities.
Thank you. We have just a few minutes for a question, and we have a question from our audience I'm going to share with our panelists, and looking forward to your answers on this. What are some creative ways to solve funding challenges and transportation issues?
I'll start off first. I think wish we had just a magic wand to be able to solve some of these concerns, specifically around funding and transportation. There's some huge barriers that we see, but something that we've seen in the past is maybe collaborating with other organizations that have similar missions, whether that be a faith-based organization and they have vans that their church may actually utilize for that church alone, seeing if they will collaborate and be able to provide transportation to, medical appointments for groups that are going, 30 minutes to an hour out. Also looking at, when we're talking about the funding sustainability, we have been able to connect with organizations that have, state funding that is, a little bit more sustainable than your typical grant funding, connecting with those organizations, working with them to see if activities that we began under a grant could be sustained under their funding. And we've been really successful in connecting with different groups when it comes to prevention as well as treatment and recovery for that.
I'm going to give you a little bit more of a macro answer to this. I think there's some advocacy to be done on both of these fronts. With transportation issues specifically, Kentucky has recently changed some of its policies around Medicaid transport. One huge barrier that we were seeing is out-of-county folks needing transportation to our clinic had a car registered in their name, couldn't access Medicaid transport, but that car hadn't run in maybe 6 months. So there are some folks looking at policy changes on that front. As for funding challenges, I think opioid settlement funding, advocating for transparency around the use of those funds and advocating for very direct interpretation of emphasizing use of those funds for prevention is really important. And I think there's some variation across states around the level of transparency on use of those funds, but I think that's a really important thing to be looking at right now.
I am actually working on a story right now about what are the odds of this. We're getting the largest settlement amount in West Virginia. It's like close to $1 billion. And what are the odds of it going to children? And most people are saying very little. So I think, thank you for noting that, because a lot of people I'm sure in the chat are also interested in where those opioid settlement funds will go.
Well, and I was even going to just extend that a little bit. So I would recommend that everyone reach out to their state mental health and substance abuse agency, because that's where you're going to see what your grant opportunities are, both from the federal grants that naturally occur and then some of these unique opportunities that are coming to respond to opioids, and specifically look at what they're offering for families. If we want to truly make a difference in children, the other avenue would be to check with your family treatment court, because they separately are really being able to enjoy some unique funding opportunities. And that's a wonderful place to partner with. If you don't have a community coalition that's focused on recovery, that might be something to bring up. And because that solves more than just the programs that we're talking about here, what we say so often after the program is complete is, so what's next waiting for the family? You can't send them back to where their family lives on a hill in Appalachia. Right, we know it's people, places, and things. And if you send them back to where they started, we know that that's going to be, they will return to old behaviors. We need to know that we are creating communities that celebrate recovery, not just for individuals, but for families. And those coalitions, those partnerships, I mean, Liza, you spoke so well about it. It's nurturing change for the entire community, and their support to create those coalitions and the treatment courts, and just looking at who those key players are in the community. Look at your faith communities. We're seeing more recovery ministry than we ever have before, but again, might need to be motivated to incorporate families. So many recovery ministries still think families are there to support the person who's been introduced to treatment, instead of thinking that family needs to enjoy their own level of recovery for the family issues. And I think with that education, it wouldn't take much to motivate additional support from them. And we've seen some beautiful networks where faith communities have partnered together as well. There's such a driving force in these small communities, and can provide some really creative options to bring, education and programming to the community at large.
Well, I want to thank you all for sharing your personal experiences, your work experience today. I've learned a lot. I want to remind everyone who has stuck around with us to please fill out a survey. Just take a few minutes to do that. You can find it in our chat. And now I'm going to turn it over to Brian Moss.
All right. Thank you, everyone. Thanks to Amelia, to Liza, to Mary Beth, and Shay for sharing your expertise and your insights this afternoon. I'd also like to acknowledge all the hard work that has gone into this conversation behind the scenes. So thanks to Molly, Sarah, Joey, Steph on our Eluna team. A special shout out to Jason Sterling, our intern, and Renee Salyers from Camp Mariposa, Kentucky, for their help in this conversation. Camp Mariposa is offered currently in rural communities in Indiana, in Kentucky, and West Virginia. Camp Mariposa is having great success in breaking the intergenerational cycle of addiction in 17 communities across the U.S. Please check out our website for more information, and feel free to reach out to me for information on how to bring Camp Mariposa to your community. Eluna is a mission-based organization that's aim is to reduce the stigma around grief and substance use disorder. So please consider supporting Eluna. There'll be a donation link and a follow-up email, as well as a survey link to help us inform future programming and provide valuable feedback. The email will also include resources mentioned in the webinar, as well as more information. Thank you, everybody, again, and have a great day.